Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clomipramine. Its brand name is Anafranil. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how clomipramine works. We'll then discuss indications or reasons we would prescribe it to patients, followed by contraindications or reasons we would not be able to prescribe clomipramine. We'll then talk about dosing with examples, followed by side effects with percentages. So how does clomipramine work? So clomipramine is a dibenzazepine tricyclic antidepressant. The exact mechanism of action is not completely known, but it's believed to be related to its ability of blocking the reuptake of serotonin. In terms of indications or reasons you would prescribe this medication to a patient, the on-label indication would be in obsessive compulsive disorder, and there's also some off-label indications as well, such as autism spectrum disorder, depression, ejaculation disorder, or panic disorder. In terms of contraindications or reasons we would not be able to prescribe this medication to a patient, we wouldn't be able to give it to a patient if they've used a monoamine oxidase inhibitor in the previous 14 days, if a patient had a hypersensitivity to clomipramine or other tricyclic antidepressants, they would not be able to use this medication, and we also wouldn't give it to patients who are in the acute recovery period following a myocardial infarction or a heart attack. What about dosing with clomipramine? So when it's being used in obsessive compulsive disorder, the initial dose would typically be 25 milligrams per day given orally. They may increase the dose to 100 milligrams per day during the first 2 weeks of treatment, and the maximum dose would be 250 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using clomipramine, so I'll go over some of those here now. 18% of patients may experience weight gain, while diaphoresis may happen between 9 and 29% of the time. Constipation may happen 22 to 47% of the time, and up to 13% of patients may experience diarrhea. Indigestion may happen in 13 to 22% of patients, and 12 to 22% may experience a loss of appetite. 33% may experience nausea, and xerostomia or dry mouth may happen up to 63 to 84% of the time. 13% may experience myalgia, and dizziness may happen between 41 and 54% of the time. 2 to 18% of patients may have a feeling of nervousness, and 28 to 52% may experience a headache. Insomnia may occur between 11 and 25% of the time, and up to 46 to 54% of patients may experience somnolence. 33 to 54% may experience a tremor, and 18% may experience visual disturbances. Some patients may experience sexual side effects, and 35 to 39% may experience fatigue. Now, some more rare but serious side effects would be orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, or hyperglycemia, which would be a increase in blood sugar. That's all we're going to talk about today with clomipramine or Anafranil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.